Today's presentation is going to be an interview with Dr. John Calderero, DMD, about general practice orthodontics. John, first, I just want to thank you for agreeing to do this interview for the students, and I really appreciate your willingness to do this. To begin with, I'd like you to tell us a little bit about yourself professionally, you know, your previous education, degrees, why dentistry?
Well, I did my undergrad at St. Louis University and graduated in 2004 and with a biology degree, and I was always interested in the medical field, and I have parents that are both in the medical field, and I thought dentistry appealed to me. So then I came to SIU and graduated in the class of 2008 and started teaching just a couple months after graduation. I also currently have a private practice in Staunton, and I practice there the other 4 days a week that I'm not at the dental school.
Okay, all right. John, more orthodontically specific, what main orthodontic appliance or appliances do you mainly use, or what appliances do you prefer or have you found useful so far?
Most of my orthodontic cases, I do straight wire with brackets and bands. But I also do a lot of expansion appliances on the younger kids, the 8-9-year-olds that have crossbites or blocked out laterals. We see a lot of those, and so I do fixed and removable expansion appliances. Most parents prefer fixed, and that's fine. They're a little easier or they're a little more difficult to clean, but then I have all the control, and they essentially don't have to do anything at home with those.
Okay.
But that's typically what I use.
Oh, okay. So in terms of expansion appliances, is there a specific design that you have found works better for you?
Well, the one I typically use is on the upper arch. I use what's called a memory screw that I activate with a little wrench, and then it's spring activated after that so that it works with slow continuous forces. And I see the patient once a month, and then I activate it a couple turns every time I see the patient. I measure the progress and just track it.
Okay.
On the lower arch, I use something called an E-arch, which is completely spring activated. And they're both bonded in. We like to bond around the first permanent molars if possible.
So they're fixed?
They're fixed.
Okay.
There's a little rest on the first primary molars usually.
Okay.
For removable appliances, I like just a simple Schwartz appliance.
Okay.
That you just activate it with a little wrench and it cranks it open, and I kind of like those because you can modify the acrylic and you can add pads if you need to open the bite and things like that. But most parents don't want to have to worry about lost, broken, and appliances.
Understood.
So
understand. John, tell us a little bit more about geographically where you practice, like how big is the population and, and things like that.
Sure. So I practice in Staunton, Illinois. It's about 35-40 minutes from here. It's a small rural town.
Okay.
Population's about 5,000. There are a couple other dentists in town. Some of the neighboring towns have dentists, but a lot of them don't. So we pull from a fairly good distance.
Okay.
The nearest orthodontist is probably 25 minutes away.
Okay.
So that's one reason why I kind of got into orthodontics, because I got that question a lot. And it makes it a lot easier when parents have to bring them in for a monthly appointment. It's a lot easier to come in town as opposed to, driving out of town every month.
Right, and having an hour or more
just drive time.
Total
Correct.
drive time.
Correct.
Gasoline cost and
Right.
all as well.
Right.
Okay. John, please talk a little bit about your general practice of dentistry. You know, what areas you do a lot of, what areas you do a little of, things like that. Obviously, doing some orthodontics is going to bite into your clinical chair time.
Correct.
And I just wondered how you make that work in your practice.
Right. I would say my procedure split is pretty standard for a general practice. You know, obviously we do a lot of restorative fillings and crowns and bridges and partials and dentures. I do not do any endodontics. I refer all that out. We do a lot of oral surgery extractions in-house, so I do a lot of those. And then we kind of just fit in the orthodontics where we can. For the most part, the records and the placement of appliances is what's most time consuming. The adjustments and everything tend to be much quicker, so it's easier to kind of slide those in. We tend to schedule a lot of those. I'll get a patient numb and then have an adjustment in the neighboring room, so we can I can just hop in, and my assistant has the patient untied, and I kind of take a look and decide what we want to do, and if I need to change anything, I do it. Otherwise, assistant will tie the patient back in and see him in a month.
Got it. I think you may have already asked the question about why did you decide to get into doing some orthodontics, but I guess my the question I really want to ask is how did you decide to get into doing some orthodontics since it's difficult to be able to know how to tell a simple orthodontic case from a hard one?
Right. So I was always interested in orthodontics. When I was a student here, we got to do a lot of our own cases, so that always interested me. And then when I started getting questions in private practice about parents, you know, why don't you offer that? Then I thought, well, okay, I'm already interested, why not? So I took quite a few continuing education courses before I actually got into it.
Great.
Because it not only did it just involve information, but more equipment. You know, I take my own steps in the office, and then after quite a few continuing ed courses, I decided, okay, I'll start with a couple select cases, patients that I know well. You know, they all know that I'm a general dentist. And I do full records, so I'm not doing difficult class 3 patients, and I still refer more out than what I treat in-house. I selectively choose what patients I want to treat because I want them to be happy. Generally the family already comes to me or is going to start coming to me, so I want to retain them as general patients. It's just an additional service that I offer to them.
Understand. Can you go a little bit more, John, into what CE courses you've taken, and also names of people who have presented these courses who you have found helpful?
Sure. The courses that I have taken have been all taught by Dr. Brock Rondeau.
Okay.
He's got pretty well-known Rondeau seminars.
Okay.
So he has different levels and tiers, and I've taken the first several levels.
Okay.
And that's where I've done all of my cases. Some of them have been online, a lot of them are live with actual labs. We bend wires, we place brackets, we're tracing
online,
steps.
so you're looking at, okay.
Well, a lot of them are live at the actual CE course, and then he'll send us home with a manual, and I have homework before I go to the next class.
I got it.
And then we get that basically graded just like we did in school, and that's how a lot of our CE is hands-on. There are several other people that offer orthodontics courses. I haven't actually taken any of the other ones because a lot of them have different philosophies, and not that I always agree with Dr. Rondeau's all of his philosophies, but you kind of decide which ones you're gonna follow, and
Sure.
that's just the path I've taken.
Okay. Of those other names, do any of those other names come to mind besides Dr. Brock?
I get a lot of advertisements from Dr. Jay Gerber.
Okay.
I'm not familiar with anything other than the name. Some of the
Okay.
people that I've taken classes with have taken multiple courses.
Gerber's course.
Correct.
And, okay.
I don't
Any
remember,
other name?
I don't remember what any of the other ones are offhand.
That's fine.
Yeah.
That's fine. Tell us a little bit about what helped you decide to get a cephalometric unit attached to your Panorex unit, and I know there's not a cheap.
Correct. So I already had the pan machine,
Okay.
and if you're going to do orthodontics cases, you have to have a ceph image, and you have to do a tracing. You got to have your measurements and do your full records. I don't have another option nearby me to send patients to do that.
Convenient.
Maybe correct. Maybe the hospital. I didn't really check into it, but
Understood.
I just knew if I did enough cases, it would pay for itself, and
Eventually,
now,
sure.
correct. And it's just
Yeah.
easy and convenient to do it in the office. We take a pan, we take a ceph.
Right. Right.
So-
And then you've got in-house, which you
Correct.
need.
Correct.
And as you go through treatment, if you need a progress set for some reason, now
Right.
you can get it.
Just get it
and
at a
you
moment's
can
notice.
look
Right.
at it, because now it's all digital.
Exactly.
Well, that makes great sense to me, John. Finally, I guess please tell us, or re-clarify maybe again for us, how you schedule on a day-to-day basis your orthodontic patients, on whom you've already done records, done a problem list, and then planned your plan the appliance treatment. How or what days of the week do you schedule them, or does that even apply?
We are pretty lenient with our scheduling because we know most of them are kids, most of them are in school, so we try to schedule around school if we can. I have 3 days a week. I start at 7 a.m. and then 1 day a week I go until 8 p.m. So we have quite a few hours where we can see patients and they don't have to miss school. It doesn't always work for days where we're placing appliances because that's a little bit longer appointment. So sometimes they'll get out of school earlier, just arrive a little late. But typically we'll do all of our records and do the analysis, treatment plan, informed consent, meet with the parents, tell them, here's what I think we need to do, and then kind of schedule accordingly. And we're pretty good about working with their schedule, and we just like to be as helpful as we can with them, because if we're good to them, then they'll be good to us.
Sure.
So just small town business there. So
I understand, John.
Right.
Well, again, I really thank you so much for doing this, and I thank you on behalf of all the students who are going to hear you and learn.
sure, well, not a problem. Glad to help.